Okay. Good afternoon, everybody. I'm Dr. Dennis Goodman. I'm clinical professor of medicine and cardiology at NYU and the director of integrative medicine at NYU Langone. And it is an absolute pleasure for me to welcome you all. We're all living through terrible times, difficult times. And I've really missed our series that, we've worked very hard on for many, many years. And we decided that we're going to do what everybody else is doing to connect back with the community and our family that are regular attenders of this seminar and do this virtually. So this is the first time and the first one that we're doing after several months break. Our last one was February 27th, as many of you will remember. And we talked about this particular topic several months ago, and of course I felt we needed to say something about COVID-19. I know you're all really sick of it, and it's hard to actually believe that it's what we talk about 90% of the time, but I did think at the time that it would be helpful just to give a little bit perspective on what can you do and what should you know. And there's so much information and misinformation out there that I decided we would talk about something that I think would be interesting to everybody, which is right in the sweet spot of our prevention center, and that is, how do you prevent getting this terrible illness for a lot of people, for some people, and just generally keep yourself well and prevent getting any kind of infection or any kind of disease. I want to start off by just thanking my team. Anya, as usual, incredible, helps me every step of the way. There'll be none of this without her. I want to thank her publicly, and you all know how to get hold of her. I'll give you the email in a second. I want to thank Michelle Liu from Communications. Michelle, thank you so much. You've been incredible helping us get this together, and we really appreciate your help. And very shortly, I'll be introducing my co-speaker today. It's a real pleasure to have her on. But before I do that, let me just again remind you that our Heart Health Lecture Series continues. We're alive and well. The next one is actually going to be the impact of exercise on your immune health. You can see we're doing a lot of stuff about the immune system and what can you do in the realms of exercise and what are the benefits of exercise beyond the ones which we all know. And so our very own Dr. Heffron and Jonas Sokolov from NYU are going to talk about the actual impact of exercise on your immune health. I'm going to touch on it today, but I'm going to leave most of it for Tuesday, November 10th, which is very soon. So here's some information. This is our website. You can see it there. You can join our email list, and there's the email, hearthealth@nyulangone.org, and you can also follow us on Twitter. And your next slide. So these are the past topics. Many of you have listened to them. I'm very proud of them. I always put them up to remind people what we've discussed so far, and we're always available if you have a suggestion about a particular topic that you'd like us to cover. We actually are getting to the point that we're now going to be able to revisit many of these topics and give you a current update. Next slide. So this in front of you, this lovely, amazing lady is Barbara George, Dr. Barbara George. I am going to introduce her as soon as I finish speaking, and the two of us are a team today. She is from NYU Winthrop, and it's a real pleasure to collaborate with Winthrop, our new sister in the family, our sister system, and we're looking forward to working together again in the future. And really, it's a first for me as well to do a program with one of my fellow doctors and fellow team members in our NYU family system. So I look forward to your talk shortly, and I'll introduce you as soon as I finish speaking. Next slide. Okay, I forgot. Questions. Obviously, this is very different from our usual situation where you put your hand up and you get to ask a question. Here we have the ability, I'm sure many of you are familiar with this, you can see on your screen there's a chat box, and you just have to enter, and under the chat box is actually a Q&A, which is what's relevant to you. You'll see a time where you can actually can do this throughout the whole talk. You can put a question in. Please try to make it brief. Make sure it's a question. And during the question and answer session, which is at the end of my talk and Dr. George's talk, I will try to get to as many questions as possible. I've already received a long list of questions by email, and I will try to address as many of them as I can. Next slide. So this is really the broad topic, optimizing your immune function for cardiovascular health, your best defense during a pandemic. Next slide. And this particular picture is from CNN. Unfortunately, you have to turn on CNN and see this every day. This is from about a week ago. And the current numbers, the numbers in the United States now, over 8 million cases. The latest death counts 226,000. And so the numbers keep rising. And we're all very aware of trying to do everything we possibly can to defeat this virus. And I want to say up front with a very positive note, we will defeat this virus. What we are desperate for around the world is a vaccine. And I know you're all listening, and stay tuned. I think it's coming in the next few months. My personal opinion, it's going to be another few months, maybe towards the middle of next year, but we will get a vaccine, and that'll change the whole dynamic. Remember, we've had terrible infectious diseases in the past that killed millions of people, like mumps and smallpox and even influenza virus. In 1918, Spanish flu, 50 million people died. And thank God today we have a flu virus and we have a medical system that can fight it. That's the coronavirus there. It actually looks very nasty, has these spikes that help it get into cells. And I'm not going to go into the history of this virus, just to say, it's been around, that we know about since November, December last year. It started off in China. We were all horrified when we saw 80,000 cases. And now you can see what's happened. It's a real pandemic around the world. The numbers are actually going up and up and up. And I'll touch on that briefly as to why I think that is happening. I think we all know. Next slide. So this is just to show you, it's just a slide. If you look, there's a line here, there's a blue line, and then you see the bar graph down here. And really, if you just look where it says national lockdown, I'm just trying to show that when you lock people down, and that means that you are quarantining people, they're locked inside, they can't go out, they can't really interact in the community and society. Of course, you can keep this thing under control, but you can't lock people down forever. And that is the tension that we have the whole time. How do we manage to have people be safe and still allow them to function and get out into the world so that we actually have a thriving economy and people are still actually active in a society? And so it's a terribly, very, very difficult situation. And you see the tension both economically and politically between opening up to let people function and the economy to thrive, and also keeping people safe. This is an example of a country where there was lockdown, and then they started to release, when they started to let people out, you see the numbers go up, and that is clearly what is going to happen in any society. Let's go to the next slide. So this is just something that I love this, this slide, because it shows you that there's a lot to learn if we just know where to look. And if you actually look, this is an article from JAMA, which is a famous journal in American medicine, the Journal of American Medicine, from August 2007, long before we knew about this COVID-19, although there were other coronaviruses around. You can see, if you look down at the bottom here, this was from 1918, and they looked at St. Louis, Missouri, and they were looking at the weekly excess death rates. And you can see this graph here where it sort of rises and then it flattens, goes down, and then it spikes up. The spikes, the big spike that you see coincided with opening schools and relieving the public gathering ban. In other words, they allowed people to publicly gather again. And it's very, very clear. Even at that time, it was very obvious to people that once people got together and started to interact and have physical contact and get close to each other, the numbers go up. But as I alluded to, how do you balance this so that people can get back to work and get back to school? Next slide. So this is just to show you, and it's really an analogy for you, what is actually happening in the body. And what happens is, I want to give you an analogy. Everybody, hopefully you've all got a kitchen. And what goes on in the kitchen is that you make things normally things that people like to eat. But it's your kitchen and you know where everything is and you use the utensils and whatever you need to cook. You use what's inside your fridge and what's inside your cupboards. And what the virus is doing is coming into your kitchen, which is your body. Because what it wants to do, any virus, any infection wants to use your own cells, your normally functioning cells, to replicate itself. And that is what you do in your kitchen. You make things, but think about somebody coming into your kitchen using your utensils, using your cookbooks, start cooking, and the next thing you got a fire in the kitchen. So it's okay. There's a fire in the kitchen. It's not the end of the world. You can still survive because you've got the rest of the house. But if the fire is not put out, it then starts to consume the house. And that's the analogy I have for this virus, that in some people, this fire rages and it actually starts to burn the whole house down. And that is what happens with some people with this virus. It doesn't just stay local to the respiratory system or the upper respiratory tracts. It gets into the body. And the next slide. And this is, I'm not getting into it, but this is all the biomolecular slide here to show you these different cytokines. Think about cytokines as being part of like an army of cells that come in to fight an infection, to get rid of an invader. And while they're trying to fight the infection, you can get something that's called, go to the next slide, a cytokine surge. And this is just a diagram of showing you that all these cells, all these proteins, IL-6, IL-2, TNF factor, that are basically there as part of your army to fight the infection, they get to a point that they overwhelm the body. So they're so busy fighting the infection, they actually start to damage normal cells. And that's what happens in some people. It overwhelms the whole system. And an important question, which we still struggle, is why do some people manage to get no adverse sequelae from this? They can be asymptomatic, and other people get so sick. And it's a big question, and it's clearly got to do with the immune system, in my opinion, the genetics, how much of the pathogen of the viral load you get into your body in the first place. But people react differently. And unfortunately, although we think it's just this high-risk group, there are some patients that are younger, some people that are younger, literally in their 30s, 40s, and 50s, that can be extremely unfortunate and unlucky, and they can get taken over by the cytokine surge. So, of course, some people, which I'll go into in a minute, are higher risk, but there's nobody that has no risk. And even though it's extremely rare in young people to get really sick, it can happen to anybody. And that's why it's absolutely imperative that nobody should have an attitude of it's not going to happen to me and it's not going to make me sick, because anybody is susceptible. And the older you are, the more susceptible. And I'll go into that in a minute in terms of risk factors. Next slide. So these are the organs involved in COVID. I spoke about the cytokine surge. You can see the lungs, the heart, the brain, the kidneys, blood clotting. It affects the clotting system because it affects the actual inner lining of the blood vessels. And when that lining becomes inflamed, the body's own mechanism of stopping bleeding starts to activate, and you get little blood clots that form in the blood vessels, and that leads to heart attacks and strokes and pulmonary embolism. So in the beginning, we thought it was mainly the lungs. And the reason that it was entering mainly the lungs is because it obviously comes in the air that you breathe, and it gets into the cells of the lungs via this, as you know, there's something called an ACE receptor, and it gets into the lung cells and affects the lungs. But unfortunately, it can actually get into other parts of the body, the heart, the brain, and the kidneys. And we all know that all these systems now are involved. And we've now got to a time in the hospitals, we know how to do the really, really good medicine to prevent these other organs getting affected. And so actually, in terms of death rates in the hospital, although deaths go up when there are more cases, the actual treatment in the hospital is better, and we know what to do to try to prevent this disease advancing in a specific person. And for example, one example is we actually know that you don't put people on ventilators early on. You try to keep them away from a ventilator as long as possible. The other thing we know is that steroids are very helpful. We know that remdesivir helps. It's an antiviral agent. So we're very, very aware now of things that you can do to prevent this. Next slide. To prevent it getting worse in the body. So this is an article just showing that the heart is also affected. This is an article from a study that showed that people who actually recovered from this virus, even many months later, we found that there was still evidence of cell damage in the heart. The troponin levels were up. We don't know long-term what this means, but clearly the heart is also affected in many, many people. Next slide. So I really want to focus on this, and I can't say it enough. It is absolutely imperative that all of you listening, and you can hear every responsible healthcare person, and I think that we've just got to really admit that everybody knows now that there's not a lot of stuff that you can really do yourself personally that makes as much of a difference as wearing a mask and social distancing. And so there's no such thing as I don't need a mask. We know now that people who wear a mask and people who get out, obviously in contact with other people in public gatherings where you're close to people, we know now this is not just droplet spread. In other words, it's not if somebody coughs within 6 feet. It can actually spread by aerosol. That means in small confined areas, you've got a chance of picking this up, even if you are socially distancing. But it's much higher risk for you when you're close to someone within 6 feet in a confined state. That means indoors. And wearing a mask is absolutely essential. And if there's one message, I wish I could get it out there to the kids, to the college kids, to younger people that feel kind of immune and they feel immortal. It's not about the fact that you yourself are unlikely to get really sick. It's that if you pick up this virus, and even if you're asymptomatic, which 50% of people are asymptomatic, you will come into contact with someone that is at high risk, and it can be your grandmother, and you can be responsible for their death. So I am really, really appealing to people, no matter how old you are, be responsible, wear your mask, and follow the CDC guidelines for social distancing and avoiding public gatherings until they say it's safe. Next slide. So what are the symptoms? I'm just doing this so that you can be aware of them. You all know this: a sore throat, a cough, a new loss of taste or smell, fever, chills, muscle aches, and severe fatigue. I'm not going to get into these, but of course, these are common symptoms. It's very anxiety provoking when you have one of these symptoms, because you think, could I, God forbid, have corona? It's important when you have any one of these symptoms to talk to your physician, your healthcare provider. Let them advise you so that you're not in a situation where you don't know if you do or you don't, and should you go to work, and what should you do, and what should you do about the people in your house. Next slide. Be in touch with your healthcare provider. Who's at risk? I mentioned this before. These are the high-risk category patients and people. If you're older than 65, you've got chronic conditions, heart disease, lung disease, obesity, diabetes. There's the heart disease, high blood pressure, congestive heart failure, atherosclerotic heart disease, lung disease, and immunocompromised people, obviously. Anybody who's had any reason to get a chemotherapy agent, or there's many people that are immunocompromised for many reasons. They may be on chronic steroids and something like that. Next slide. So that's my mother, and I really wanted to tell you how much I love my mother and how scary it was for me being here. She lives in South Africa. She's 88, and a few weeks ago, she was getting short of breath, and she had nausea and vomiting, and I really wanted to keep her out of the hospital. We did everything we can to take care of her at home. She couldn't manage. She's got a caregiver. They took her to hospital, and she was diagnosed with COVID. And she was in the hospital for a week to 10 days. And the first time I spoke to the doctor taking care of her, the first thing he said to me is, I'm sorry to tell you, your mother's not going to make it. Because at her age, with the resources that we have, there's not much we can do. And it was a terrible feeling. I couldn't travel to South Africa. I was told I wouldn't be allowed to see her. She's on her own in the hospital. But I just say, miracle, Baruch Hashem, whatever it is, I prayed, and she's alive today. And so you get, as I said, you can be unlucky, but you can be lucky too. And I think that one of the reasons that she is alive today is she got this incredible, strong, fighting spirit with an incredible attitude. And so I'm big on the fact that our immune system is boosted when you've got something to live for. Then there are people in your life that care about you, that you want to stay alive and you don't want to give up. So really important is that you connect with people that you care about, especially family members and elderly people, so they don't feel isolated and alone. Because if they know that you care and that you love them, they want to live and they'll fight this as much as they can. Next slide. So what's the problem in the age of COVID? Among the many lessons we've been blind to is that the burden of non-communicable chronic diseases has led to a human civilization in danger. What is clear from COVID-19 data is that the risk for severe manifestations and death are being driven by the interaction of viral illness with unwell population. In other words, people that are at risk are more likely to have other chronic medical problems. And if we can keep ourselves well and healthy, we're much more likely to be able to fight this. Let's go to the next slide. So to get to the meat of this in the next few minutes that I have, it's all about these 4 things that keep us healthy and boost your immune system. It's nutrition, it's exercise, it's sleeping properly, and it's attitude and gratitude. And this here is stress management. And that's why I put this slide up here. Being able to cope with stress and deal with stresses in a healthy way so that your immune system is not depressed. Next slide. So what can you do to boost your immunity? The fundamentals haven't changed. This is something I talk about with all my patients. What can you do to be healthy? What can you do to feel well? And I always tell people that wellness is not the absence of disease. When you go to the doctor and he says, you're okay, there's nothing wrong with you, that's fine. We can't find anything wrong with you right now, but you may not be well. Wellness takes a lot of work. You have to look after yourself, and that means doing things that Barbara's going to talk about as well that keep you healthy. So nutrition, exercise, stress management, and sleeping properly. Next slide. So aerobic exercise, there's a lot of evidence that aerobic exercise boosts the immune system. I'm not going to get into the details now because you're going to hear about this in November from Dr. Efron, where we're going to get into the details, and I hope you will join us for that seminar where we're actually going to tell you how does aerobic exercise boost your immune system. I am, again, imploring you, do some kind of exercise every day, even if you're indoors, if it's just stretching, if it's just walking on the spot, maybe you've got a stationary bicycle or a treadmill or something, but you must get your body moving. And any time that you exercise, which means that you get your heart rate up a little bit, makes a huge difference to the immune system. So the recommendations are that you try to walk for 30 minutes every day, 150 minutes a week of moderate exercise. It's just a brisk walk, or even as fast as you can. It doesn't have to be brisk, but as fast as you can, to be able to boost your immune system. 150 minutes per week of moderate exercise. That's the guideline. Next slide. This I'm going to pass for now. It's just showing you, it's a study that showed how the immune system is boosted. It was a mouse study that when the mice are forced to exercise. What about some supplements? I've had a lot of questions. I'm going to go through them, and I'm not going to go through in detail, but these are the supplements that I believe there's some evidence that they can be helpful. Vitamin C, 1 gram a day, boosts the B and T cells of the body. These are important cells for fighting infection and boosting your immune system. Vitamin D is based on your level. You should have a vitamin D level checked. I am a believer that vitamin D is important, and you don't want to be deficient in vitamin D. I'll show you a study in a minute. It mediates the immune response. Vitamin E, vitamin B6, zinc, magnesium, and elderberry. There's no problem us giving you these slides or giving you this information. You can just email Anya and we can send you this one in particular so you can see what each of these supplements do and how much you should be taking. And of course, if you have a question about it, I just don't have time to get into the details on it. But these are the supplements, many of which I take, that I think can be helpful. Next slide. This was a study that was recent. The association of vitamin D status and other clinical characteristics, they showed that in 489 patients, those that had a vitamin D level of less than 20 had almost double the risk of getting COVID. You need to know there are not a lot of great studies out there. It's hard to do good double-blind randomized studies with supplements, and there's no definite evidence. But I am a believer that those supplements I suggested to you can boost your immune system and can help you. So nothing's for sure, but they may help you. The other important thing is that if you can eat a healthy, very healthy diet with lots of vegetables, you may not need these supplements. But most people are not getting a very healthy diet with a lot, especially green vegetables. Next slide. So this is a book I wrote about magnesium. I'm a big fan of magnesium. It also helps to boost the immune system. And I won't get into that, but maybe one day I'll give a talk about magnesium. Body does not make magnesium. It's another essential, a very essential mineral that you should be getting enough of either in your diet or supplementing. Humor, altruism, and kindness are way more contagious than a virus, but it's up to us to spread them. And that's a friend of mine, Jan David, who said this. And what this is really saying is, yes, there's a virus, it's very contagious, but we can do something about it, which is to interact in a kind way and help other people. And that really helps them to be well and helps them not to have to deal with this virus alone. Next slide. So stay connected. I pointed this out to you. Stay connected to other people. Make a huge effort to reach out to people that may be alone and may be lonely, because it boosts their immune system just to know that you care about them. Many years ago, I had a patient who needed a carotid endarterectomy. It's surgery to unblock an artery in the neck. And he was alone. He had nobody. And he was in his 60s. And I went to see him just before he had his surgery. And the surgeon had just been by. And this patient was, lovely man, devastated. He said, I'm not going to have the surgery because the surgeon said, I'm going to have a stroke. And I knew he didn't say that, but he obviously told him about the risk factors. And he didn't want to do it. And eventually I calmed him down. And I said, I sent you to that surgeon because he's got great hands. You're going to be fine. And I managed to get him to agree to go to surgery. And just before I left the room, I turned around to him, and I don't really know why I said this. I said, don't forget that I love you. And he looked at me, and I left. And 2 weeks later, he came to my office, and he said, Dr. Goodman, I need to tell you, the only reason that I wanted to stay alive and that I was going to have that surgery is that I thought to myself, if there's one person left in this world who cares about me, I want to live. Remember that story, because there are many, many people, if they feel isolated and alone, they don't have a desire to fight disease and illness because they feel like life's not worth living. And so I really want to implore you, stay connected, show the people that you care around you, and reach out to people that are not in your family and are out there that are alone, and make them feel that you really care. Next slide. I want to end off. So breathing exercises, we don't have time for this. If I have a moment in the question and answer, basic breathing is really important. Breathe in for 4, hold for 7 seconds, for 7 counts, and breathe out for 8. You do that twice a day for 10 minutes. It really helps you to feel relaxed and less likely to be stressed. Next slide. So if you've got a good attitude, you're more likely, I've told you, to be able to deal with this stress. And I want to end off with a little video. It'll take 2 minutes. This is Itzhak Perlman, who's a famous violinist. We can play this on here. He got polio when he was 4 years old, and he comes onto the stage in his calipers, and he plays. And I want to tell you what happened one day. This is a little short video, and it's my last slide. I appreciate you being here. There's our address if you want to be in touch with us. It now gives me great pleasure to welcome Dr. Barbara George. Barbara George is a certified adult gerontology nurse practitioner, as well as a registered clinical exercise physiologist with over 30 years of cardiology experience. She's at NYU Winthrop. Dr. George was instrumental in developing the Center for Cardiovascular Lifestyle Medicine. She leads a multidisciplinary team of experts for both the lifestyle program as well as NYU Winthrop's cardiac rehab program. She's actively involved with advancing academic, clinical, and research achievements within the Division of Cardiology. She's committed to providing patient-centered, culturally sensitive lifestyle change interventions and promoting healthy behaviors for all individuals with or who are at risk from cardiovascular disease. She's active in promoting heart health. Dr. George serves as a program coordinator for many community-based events. She's involved with the American Heart Association, American College of Cardiology, Women's Heart Disease, and other national organizations dedicated to raising awareness of heart disease. Barbara, thank you, Dr. George, for joining me today. You've got the same amount of time I told you you're going to have. Don't rush. And welcome. And I really appreciate you joining our seminar today.
Great. Thank you, Dr. Goodman. I really appreciate you inviting me to talk about cardiac care during the pandemic. I also wanted to give a shout out to Anya and Michelle for doing such an amazing job, not only for this series, but the entire Heart Health Lecture Series behind the scenes, because for those of us that were novice to virtual community-based programs, they've really been instrumental in making things run as smoothly as possible. Next slide, please. So I have no disclosures, but really next slide, I wanted to talk about kind of piggybacks off of what Dr. Goodman talked about, but which is knowing during this time or refreshing us as to what it is a heart attack and stroke look like, what the signs and symptoms are, how you can know when and how to seek cardiac care during this time. Many folks are extremely anxious about entering an emergency room. Know what the safety procedures are that we have put in place so that you can return to not only have preventive care that many of us have postponed, but also to seek help should you experience any of these symptoms. And then lastly, again, piggybacking off of what Dr. Goodman was talking about, really getting into tangible things that we can do to help boost our immunity so that we can help reduce risk for cardiovascular disease. Next slide. So I'm going to bring you back in time. And if you look at this is February of 2020. And it feels like a lifetime ago, but this month is very busy for those of us in cardiology. It represents a month that we talk to our loved ones about how we feel about them. But it's also a month that is recognizing heart disease for both men and women. And I am very much involved in a lot of community-based talks like this one tonight, only it had been in person. Next slide, please. And typically what I do during my talks is to talk about the cardiovascular system. And when we talk about heart disease and stroke, it really is not just a disease of the heart. I like to use the subway system as an analogy in that we have a circulatory system. And we have to make sure that it is running similar to, as best we can, our subway system. And if there are any blockages along the way, whether it's in your neck, you might have a stroke, in your heart, a heart attack, or anywhere else in the system, we want to make sure that that system is running as smoothly as possible. And we also want to know and continue to know, even though it has improved, that unfortunately heart disease remains to be the #1 killer for both men and women. Next slide, please. So if you want to know or need to know, and this is one of the reasons why we're giving this talk, is because many of us have to be reminded what the signs and symptoms of heart disease and stroke are. And for men and women, you can have discomfort, chest discomfort, back pain. You might even have some nausea or unusual fatigue. And for women or diabetics, sometimes you might have just a little bit of shortness of breath or unusual fatigue. But for those of us who are living at home in a pandemic, this sounds awfully familiar to what the other signs and symptoms are of COVID. And many of our patients delayed going to the emergency room because they did not want to catch the virus. Next slide, please. Similar to heart attack, stroke has other symptoms that we need to be aware of. And FAST is the acronym that we use to tell patients if you're experiencing any facial drooping, arm weakness, speech difficulty, again, just like heart attack, you need to call 911. The time is muscle for the heart, time is brain function preservation. Next slide. And women are at much greater risk for stroke. And what we're finding more and more over the last decade or so is that now that we're finally doing a lot of our clinical research with women involved, we're finding that the years that women are bearing children and during pregnancy, that there are certain conditions like preeclampsia and gestational diabetes that can increase their risk for stroke. It's very important that not only are they aware of the symptoms, but that they seek help when they are having those symptoms. Next slide, please. So for everyone here, I'm sure you have heard this over the many lectures, but on the right-hand side, these were the risk factors that we typically would tell patients: don't smoke, maintain your blood pressure, high cholesterol, diabetes, try and manage your weight, try and keep moving, and a low HDL or the good cholesterol, which is associated with smoking and depression. We also know men typically develop heart disease earlier than women. However, once we are postmenopausal, it's kind of an even playing field. If you have a family history of premature heart disease, whether it's a man under the age of 55 or a female under the age of 65. And one of the other things that we are more than aware of now, and it has become even more relevant with COVID, is that there are significant racial and ethnic health disparities that exist within cardiovascular disease, with African Americans, whether they're men or women, having the highest rate of both stroke and heart disease. And on average, women of Hispanic descent are likely to develop heart disease 10 years earlier than non-Hispanics, with greater risk for diabetes. Next slide. And we're also learning more and more about these other emerging risk factors. And like I mentioned, pregnancy-related conditions, autoimmune diseases, breast cancer treatment, and again, the emotional piece of risk factors, depression, and other disorders. Next slide. So what I do at this point in my February talk is to talk about how we can address those unhealthy lifestyle practices, which are the foundation to building up for risk factors, eventually resulting in a heart attack or stroke. And that's where I try and focus most of my time during these February events. Next slide. And I start with prevention. And as Dr. Goodman talked about, this is the best thing that we could do to reduce our risk for cardiovascular events. It could happen as early as during pregnancy, when we need to continue to eat healthy and practice those healthier lifestyle habits. But it also begins with our children, and we have to encourage them and be role models for them so that they don't develop those unhealthy lifestyle habits. Next slide. And last year, the cardiovascular disease prevention guidelines came out, and we all know this. We need to manage our cholesterol, try and be tobacco-free, emphasize a healthy diet that includes vegetables, fruits, legumes, whole foods, whole grains, manage our diabetes, our blood pressure, and get at least 150 minutes per week of physical activity, along with adding possibly twice weekly some type of resistance exercises. Next slide. So now we got through February, and on February 29th, yes, if you can believe it, this is a leap year, and I'm sure all of you that are watching this, which we just leaped through the entire 2020 year. But in cardiology, when we get to this point in February, we all give ourselves a pat on the back. We had another Heart Disease Awareness Month that was a success. It's time to relax, and it's time to really hope that if we did impact at least one individual, we have done our job during the February month. Next slide. Then came March. and it came in like a lion, but not out like a lamb. And that's when coronavirus came to the shores of the United States. Next slide. And the world as we knew it was turned upside down. And this is something that none of us have experienced, nor hopefully we ever will. And we get through this together. Next slide. And how did the pandemic change our lifestyles? Well, this says it all. The world temporarily closed. Next slide. So what do? So we're stuck inside. We're told we have to stay away from other people, stay indoors. A lot of people apparently started making sourdough bread, but many other people started getting back to those unhealthy lifestyle behaviors that we talked about during the month of February, which is eating processed foods, chips, candy. Next slide. And also, we started to be obsessed with the headlines. Every hour on the hour, 24/7, we were wondering what was going to happen next. So we started to sit more, be physically less active, and really we were in a state of high anxiety and stress. Next slide. And then for those that had to work from home, that brings in a whole host of other issues. And I commend parents and single parents especially who have to juggle working from home with their children while they're trying to manage all the other stressors that they're dealing with, whether it's employment or food insecurity. And again, trying to navigate through a virtual world that most of us were not familiar with. Next slide. But there were those of us that couldn't stay home, and those were the essential workers. And it's not just healthcare workers, it's the workers that we have had to rely on throughout this time. And I can't stress it enough, and I know Dr. Goodman talked about this. They are so essential to how we got through this in New York City. Whether you're delivering food or mail, or you're bringing PPE to hospitals, these are essential workers that we need to acknowledge. And we need to understand how they're doing and what they're dealing with, trying to not only take care of their families, but also take care of themselves while they go to and from work. Next slide. And unfortunately, because of this confinement during this time, we really did go back to overfeeding, eating unhealthy, and being physically less active while becoming more stressed, all contributing to atherosclerotic cardiovascular disease. Next. Which leads to reduced fitness, reduced lung capacity, heart function, increased adipose or fat cells, increased inflammatory biomarkers, a reduction in muscle mass, and ultimately, again, contributing towards increased risk for cardiovascular disease. Next slide. So this is our new normal. Next. For the time being anyway. And what I can say is, despite all of the stress and anxiety and confinement that we've been subjected to, we still are able to find time to be with our loved ones, even if it is wearing a mask. Next slide. So I won't go into the details of what coronavirus is, but Dr. Goodman talked about the risk factors, the signs and symptoms and risk factors. And what to look for. We are still learning so much more about this virus. Next slide. One thing that is apparent, and it has really added to what we already know about health disparities in COVID, is that Black and Indigenous Americans really have a much higher risk of dying compared to white and Asians, at least a double amount of death rates in these particular groups. And again, a lot of this has to do with social determinants and other issues, but that's for a different discussion. But it is apparent that we need to really address health disparities across the board. Next slide. And the other big thing that we have found is the emotional toll of the well-being of individuals. Next slide. Anxiety, depression, panic. These are all things that we're all experiencing, not just folks who have already had underlying emotional or mental health issues. Fear about your own health, your loved ones, your financial situation, job loss, changes in eating and sleeping, difficulty sleeping, concentrating, chronic health problems, mental health conditions, and increasing alcohol, tobacco, and other substances. Next slide. And that wreaks havoc. It promotes atherosclerosis. The fight or flight is acute stressor, but we're now in the chronic stress phase where we can absolutely increase our risk for heart disease and stroke. Next slide. And this could potentially lead to acute cardiac events. And this is where, next slide. This is where we thought we would start seeing more and more heart attacks and strokes coming to the emergency room. And this was only one snapshot of Massachusetts and what happened once we went into lockdown. As we saw a spike in COVID-19, we also saw an inverse drop in heart attacks coming to the emergency room, so much so that we didn't know what was going on. Next slide. One of the biggest things that we do know was fear. Understandably so. I would sit in my office and I'd hear ambulance going by every couple of minutes, and it wasn't because someone was having a heart attack, it was because someone was going in with COVID. And all the people that were postponing their heart attack symptoms and their stroke symptoms and uncontrolled hypertension were staying home. And that's one of the reasons why we want to really emphasize that it's safe to return back to hospitals, to your doctor's appointments, to get those prevention and screening that we so desperately want you to get to avoid having a heart attack or stroke. Next slide. So what can you do during this time to stay heart healthy? Well, for one, we already talked about your symptoms. We already know that getting regular checkups, whether it's your annual prevention checkup or it's regulating your diabetes or your hypertension, or making sure that you're getting those medications adjusted if need be. And then finally, we'll end it with how we can adopt healthier lifestyle habits. Next slide. So this is the Langone COVID Army. And while I was giving talks in February, January, they already were preparing for this, knowing what was going on abroad. And they're here for you. And I want everyone to be aware that we take all the precautions necessary to provide the safest possible care, not only for you, but for us as well. Next slide. And I'm happy to say at NYU Winthrop, which is part of the family now, we really have been seeing much less. What we did has now helped really squash that curve. And what we need to do, though, is continue to be diligent. Next slide. The emergency departments, like I said, in hospitals, we have all the possible infection prevention policies and procedures in place. If you need surgery, you get tested prior to it for COVID, even if you are asymptomatic. Our doctor's offices are all open. For the most part, and if you feel uncomfortable coming in, we have video visits for new and current patients. In fact, that's how I did all my visits throughout the pandemic. And patients really loved it because if nothing else, they were able to hear, if just by telephone, or see someone else while they were isolating. And then if you are having flu-like symptoms, we recommend you stay at home and you utilize the virtual urgent care, which is open 24/7, if you have the ability to go on virtually. However, I can't stress this enough. If you're having any of these difficulty breathing symptoms or signs and symptoms of a heart attack and stroke, 911 is the way to go. Next slide, please. So I live out in Nassau County at NYU Winthrop Hospital, not literally, but that's where I work. And we are the youngest sibling in the Langone family. Next slide. And as you can see on the right, this is pre-COVID, obviously, because no one's wearing masks. But what was nice about joining this group is that we have been able to close a loop in terms of anyone who lives in the city or has services or hospitalizations in this city and they want to come out to to Long Island or vice versa. We are able to provide a continuum of care. And in fact, I oversee cardiac rehab, which is basically a gym for patients who have had heart attacks. And we are reopened. The 4 cardiac rehab programs within the Langone system has implemented all of the safety precautions in order for you to exercise safely. As you can see on the left-hand side, it's really important that we let you know if you have had an event and you qualify that you can come to cardiac rehab. Next slide, please. So 5 ways to keep your heart safe. this fall. As Dr. Goodman stressed, I cannot stress it enough, wearing a mask, keeping socially and safe distance, and washing your hands. We are about to enter the fall. With that, the first holiday is Halloween, Thanksgiving, Christmas. There's a lot of people talking about what they should do. Should they visit their family? This is a very, very challenging time. What we're doing now might be a great option, is to do a virtual Thanksgiving and make sure that if you are with others, especially those that are vulnerable, you continue to wear that mask and be safely distant. Get that flu shot. COVID-19 and the flu season, we have yet to get through this, and we're going to get through it together, but we don't know what's going to happen. The flu shot is one way that you can protect yourself. And if you have some concerns, please let us know. Speak up and don't wait for your care. Take those medications as prescribed and keep up those heart-healthy habits, staying active and staying calm. Now, I know we're pressed for time. It's 5 to 6, so we might want to, let me just, next slide, please. So heart-healthy lifestyle, again, next slide. We can talk about how we can boost immunity. We talked about it a lot, managing your stress, healthy eating, adding more fruits and vegetables, being more active, trying not to smoke, although a lot of people do continue to smoke during stressful situations, trying to get those 7 to 9 hours, and trying to step away from the television or computer while staying connected to those that you love. And this is ideal. And I want to stress this because there are many folks, whether you're on the call today or you're out in the communities with your families, there are a lot of people that don't have the privilege of isolating alone, and they live in multi-family dwellings, or they don't have access to healthy foods. If you could just do one thing, is try and stay safe and add one healthy activity or food or deep breathing. These are things that might be approachable for you during this time of stress. And I ask that you reach out to whoever it is that cares for you, whether it's a healthcare provider or a clinic or a hospital, and find out what you can do and what services are available for you. Next slide. Be more physically active. Next slide. And again, physical activity, and Dr. Heffron will talk about it, so we can skip through the physical activity piece of it, but it does have so many benefits. 150 minutes of exercise is really the minimum in terms of giving you those benefits. Next slide. Next slide. And working from home, step away from that computer. Next. And we'll skip this one. Thank you. We know that sitting too much along with the 150 minutes, even if you do this ideally, if you're sitting in the computer the rest of the day, you're more likely to increase your risk, not only for diseases like diabetes and hypertension, but cardiovascular disease. We just have to realize that if we're going to exercise, we need to adhere to the safety guidelines that we have in place right now. Next slide. And wearing a mask, for those of you, many patients have asked me this question. Yes, you can exercise with a mask on. Our patients in cardiac rehab exercise with their masks on. We might have to adjust their exercise prescription to a lower intensity for those that have heart and lung conditions. But for the most part, you can safely exercise as long as you practice all the infection prevention guidelines that we know of at this point. Next slide. Start with baby steps. Next slide. And there are so many parks out there right now, especially with the fall foliage about to peak down here. Next slide. And they're all free. Just wearing that mask and being socially distant. Exercising indoors using dance is a wonderful way to sneak in some exercise. Keep going. Eating healthy, trying to return to that Mediterranean lifestyle pattern of eating with lots of fruits and vegetables, whole foods, lots of color, and a lot less processed foods and takeout foods. Next slide. Avoiding foods like this and adding, next slide, foods that are whole grains and very little meat. Next slide. And again, this promotes so many benefits, including immune disease immunity boosting. Next slide. Remember that calories come in liquids as well as solids. So water is the preference of choice in terms of beverages. And if you plan on drinking alcohol for women, 1 glass a day, two for men are the guidelines. Next slide. But it's not the grog. And that's what a lot of our patients do or have been doing during this pandemic while we are being locked down. Okay, next slide. Portion control, next slide. Sleep, 6 to 8 hours, very difficult to do, but trying to keep a routine. Don't eat close to your sleeping time, and then try and get that regular physical activity, managing your stress. Next slide. And lastly, I know it's 6 o'clock and we are 2 minutes away from wrapping up before we take some questions, but really the mind-body connection. Next slide. I can't stress this enough, no pun intended, that there is so much that we've been dealing with, and what we need to be aware of is what it's doing on our bodies, how we can seek treatment, how we can address our emotional health. If we feel that we need additional help, taking care of our mind as well as our body, connecting with others, as Dr. Goodman recommended, and connecting with your communities and faith-based organizations. Next slide. There are a lot of resources out there, both within our hospital systems, but also community resources, as well as online through the APA. I implore everyone to look for these resources if you think you need some extra help. Next slide. And lastly, and this is one of the things that I usually do in person, but laughter is an incredibly powerful tool that we have. Physiologically, we've been shown that it improves circulation. It actually helps boost our immune response. It enhances mental functioning and a whole host of other things. Next slide. However, we're not really able to do that right now unless we wear masks. So if we are with others, please, I ask you, if you are going to break out in laughter, do it in a safe way, because it is considered a super spreading event. Next slide. Resources, I discourage Dr. Google. I tell my patients, next slide, if you plan on looking for additional resources, I put together these resources on the right-hand side that I gave to all my patients during the pandemic peak, whether it's the American College of Cardiology, the American Heart Association, Diabetes Association. We need to go to the places where the science was done and the research was done and the guidelines have been formed in order to get the correct information, because Dr. Google gives us a lot of misinformation. Next slide. So to summarize, what do we do for our hearts during a pandemic? Well, we know that cardiovascular disease still is there and remains a leading cause of death for both men and women. We know getting regular checkups, whether it's in person or through a telemedicine visit, really does help reduce your risk. Know those signs and symptoms of heart attack, stroke, and COVID. And let's all together reboot our lifestyles as we can, as best we can, in a safe way to optimize cardiovascular health while boosting your immunity. And lastly, one of the things that I am very much interested in further understanding is how we can further understand gender, race, and age-specific research to address the long-standing racial and ethnic health disparities that have been revealed during this pandemic. Next slide. Thank you, and I just want to leave this with, when you leave this talk today, I would absolutely stress that you look to at least one other person, whether it's a neighbor, a friend, an elderly woman that lives in your building, and please reach out to them, because if we don't take care of each other, we're not going to get through this pandemic in a healthy way. And I know we will get through it, but we are all doing it together. Thank you so much. I really appreciate it. And now we're going to open it up to questions.
Hi. Barbara, that was fantastic. Really, I really enjoyed it. And I think that we're so much on the same page. I couldn't help thinking about how much information we've really both imparted in a short time. It's just a shame that we have to be like speeding away. But
right.
there are two things I just want to tell the audience. One is, I'm sorry about the sound on my little video. We're going to send you the link because it's a very powerful video of Yitzhak Perlman being in a stressful situation and managing to adapt to it, and then having one of his best performances ever with one string missing from his violin. And I think it speaks to the time we're in, that we have to step up. It's stressful, it's tough, but the way you step up, the way you boost your spirit is to lift someone else's. And we see that all the time. I wanted to allude to one other thing that I think is really what we were saying today. I've always tell people that fear, F-E-A-R, also stands for false expectations appearing real. False expectations appearing real. And what I'm trying to do and what you're trying to do is educate people so that they know the facts. And something you said, which I think is absolutely critical, is reach out to healthcare providers if you've got a question. Reach out to your doctor, and don't be afraid to come to an emergency room. We actually know today that this virus is spread outside of hospitals. People are petrified of coming into an emergency room because they're scared they're going to get COVID. And the truth is that inside these systems, there's a lot of protection. People are very aware of the spread, and it's minimal spread amongst healthcare workers, if any, today because of the PPE, and we're so aware of it. So the important thing is, don't not call your doctor, and don't not call the 911 if there's a chance you're having something serious, because you need to be in the hospital. So I wanted to emphasize, and you made that point. You've given a lot of resources. All the questions I got have been answered that are related to this condition by the two of us in the last hour. So I think one of the things I'm going to suggest, Anya, is maybe you're going to tell us how to get this recording, because I'm not going to repeat some of the things that we've been saying there. I got a lot of questions about how do heart attack symptoms differ from men and women. It's another topic. There's a lot of questions about statins, and are there alternatives to statins for high cholesterol? These are all things that we can address at other times. But I want to thank my team again. I want to thank Anya. I want to thank Michelle. Dr. George, you were terrific. I think we can actually try to do some more of these together, because we both know that the most important thing people can do is to prevent getting ill and getting diseases. And that isn't something that you can just take for granted. And so my whole emphasis and push to do these conferences is to educate people so that they're not in fear, and that they have the facts and they can step forward. And let's all remember one thing: attitude and gratitude. I'm very grateful to all of you for joining on and joining us. I look forward to seeing you again on November 10th. And I'm very grateful to my team and to you, Dr. George, for giving us an outstanding presentation. And with that, we're going to end this seminar.
Great. Thank you, Dr. Goodman.